Good afternoon. This is Dr. Famuyiwa with Montgomery Fertility Center. So today we're going to ask a simple question. What does the term IVF stand for? What does it mean? IVF stands for the word in vitro fertilization. It is the process in which the eggs of a human being, or they also use it in zoos, the egg is brought into contact with the sperm, and this is done outside the body, hence the name in vitro. The in vitro term is actually a Latin word that means it refers to glass. And this simply refers to the experiments of the old days where most experiments were conducted in glass tubes, hence the nickname test tube babies. But in actuality, the process is done in round dishes. They're called Petri dishes, not really a test tubes that are used. It is a form of assisted reproductive treatment for patients who cannot conceive either through intercourse or through insemination, or if they want to use a gestational surrogate, or even if they want to avoid the transmission of a known genetic disorder that may be lethal. So the process usually involves monitoring, stimulating the woman, monitoring her response to stimulation, and collecting the eggs under anesthesia. Once the eggs are collected, they're usually fertilized outside the body in a dish, either by placing the sperm on top or inseminating the sperm directly into the eggs, called intracytoplasmic sperm insemination, or ICSI. And that's probably one of the more common pictures people see when they think of IVF. They see the picture of the sperm being inserted into the egg. That's just one way of fertilizing it. And then the resulting zygote, the embryo created, is cultured for anywhere from 2 to 6 days and can be transferred back into the uterus as a fresh transfer, or can be frozen and transferred later. Certainly, if we're doing genetic studies on the embryo before we transfer, then the embryo has to be frozen while we wait for the analysis of the genetic testing. The part that's tested is actually the part that will ultimately form the placenta. So not the part that will form the baby. And a few cells are taken off those layers and sent to a genetics lab. The results typically come back in about 10 to 12 days, at which point we know which embryo is genetically normal and which is abnormal. So typically you try to avoid one that's abnormal, such as trisomy 7, which is not compatible with life anyway. So I hope this answered that question. We're going to be talking about more aspects of IVF in our following series. Thank you. This is Dr. Famuyiwa again.